Deputy Chief Medical Officer for England, Professor Jonathan Van-Tam, thank you for joining us. We've had lots of viewers actually wanting to thank you for your clarity during the government briefings during the pandemic. Let's hopefully get some more as we go through these questions. The first one is about how vaccines work. Margaret Phillips asks, how can the AZ vaccine, the Oxford one, protect against serious illness but not mild? That's the hope anyway, isn't it?
Yes, it is. So what vaccines do is that they basically trick your body into thinking you have the infection. And in doing so, because you think you've got the infection, you then make antibodies to it. And once your antibodies are there, and that doesn't happen all at once, it takes several weeks for those antibodies to appear. And when I vaccinate somebody, I say to them, no, look, remember, you're not instantly protected. Don't walk out of here and think you're protected with this kind of magic shield that's around you. It will take weeks for the vaccine, for the antibodies to build up. But once you've got those antibodies, then if you encounter the infection, either the antibodies will just bang, deal with it and stop the infection taking hold, or the infection will take hold, but the antibodies are there immediately for you. And because they're there immediately, they get to work on the virus immediately and make the illness less severe. And that is almost certainly why we are expecting this signal of less severe disease in people who've had the vaccine, even if not 100% of infections are prevented. And remember, all the clinical trials looked at the prevention of infection, except the AstraZeneca one, where they already have some data showing that in vaccinated patients, in the original phase 3 trials, basically there's a very, very low signal of needing hospital care.
Yeah, which would be a game changer, of course. Judy
Massive
Fruki
victory.
is one, massive indeed, is one of many people asking about vaccinating children. Let's hear her question.
As the mother of a clinically extremely vulnerable child, my question is, how do you plan to protect them whilst allowing them to partake within society? Will they be vaccinated?
Jonathan Van-Tam, we've seen reports in the Telegraph today that all children could get COVID jabs by the end of this year. What's the latest on that?
So the immediate thing to say is that the JCVI has been very clear that children who are extremely clinically vulnerable can be considered for vaccination. But that is a decision that needs to be taken individually between the parents and the child after discussion, because the vaccines are not currently licensed in children. Now, that shouldn't put you off if your doctor agrees with you that it's the right thing for your son or daughter to be vaccinated because of their vulnerability. But it is always an individual decision when you're using medicines and vaccines outside of the label. Now, in terms of vaccines for children more generally, will that come to pass? I believe most of the major manufacturers are now starting to turn their attention to, can we do some clinical trials to prove that our vaccines are safe and effective in children? And I know of several that are now underway, looking at basically the kind of teenage group. And it is perfectly possible that we will have some licensed children's vaccines for COVID-19 by the end of the year. It is perfectly possible, but not assured.
OK, thank you for clarification on that. We've had countless questions about mixing vaccines for your second dose. Charlie Singh says, my mother has had the AstraZeneca jab and I'm extremely worried she is not protected. Will the government inject the Pfizer jab on the second occasion? I can't stress how many questions we've had about this issue. Yes,
OK. So I know all about the mix and match study, as it's called, that we are now setting up in the UK. And indeed, I expect that this week the first patients will be vaccinated as part of that mix and match study. The reasons for doing it are twofold. One is that we absolutely do not want our vaccine program to falter at any point, not now and not in the future. And we do know that these vaccines are difficult to manufacture and that they are in constant demand and very heavy demand right around the world. And so I wouldn't want to take any risks with the fact that if one of our supply lines went down permanently or temporarily for some reason, that we couldn't maintain the momentum of the vaccine program. So if we get some data on mixing and matching between the two that are deployed at the moment and potentially others to follow in the future, then it gives me that readout on the kind of immune response and gives me confidence to know if I am forced into that corner, which of the alternative vaccines I could finish the program with, if you like.
That's going to take some time, though, isn't it? So what about if you're in a situation right now where you're concerned about the fact you've had AZ, AstraZeneca?
I wouldn't be remotely concerned that I'd had AZ at the moment, because I don't actually think you should believe that the headline data on the supposed difference in vaccine effectiveness between the two is telling you too much, because it's telling you about the prevention of infection. It's not necessarily telling you about the prevention of severe disease, which we talked about earlier, about hospitalisation. And I can't tell you yet anything about severe disease and the Pfizer vaccine, but I can tell you that AstraZeneca have published data on hospitalizations, and to date there have been 2 people hospitalized with COVID-19 in people who received the AZ vaccine in the trials. One of them was hospitalized, I think, on day 2 after they had the vaccine. So absolutely no chance at all that the vaccine would have worked by then, and almost certain that they were exposed to the virus before they even had their vaccine. And the other one was at 10 days. And again, absolutely no chance that a vaccine would give you meaningful antibodies in 10 days. So I kind of discount those 2. And if you discount those 2, then that's no hospitalizations at all in the AZ arm. So please don't worry about that.
OK, could you comment, sorry to interrupt you there, on reports today, front page of the Sun newspaper. We understand that a single dose of Pfizer and AstraZeneca appears to offer high levels of protection, even for older people. This appears to be some good news that we're all desperate to be getting.
We have always said, and the advice from our JCVI has always been, that there should be really substantial protection from the first dose of either of these vaccines. And that's why we've gone down the priority first dose route, because that way we protect more people in the shortest amount of time and we save lives. Now, that is what we've said from the JCVI. I know that you're referring to the reports in the Sun, the leaked report. I'm not going to comment on leaked data. What I am going to say to you is be very cautious about how you interpret something that a journalist has interpreted and put in the paper. And I am nevertheless quite confident that we're going to start to see some proper signals that Public Health England will be ready to share widely, not just in the UK, but internationally, within 1 to 2 weeks.
OK, on to the gap between doses you've mentioned. An NHS worker who didn't want to give us their name says, I've been invited for my second jab 14 weeks after the first. Will the longevity of this gap put me at a disadvantage?
No. Generally speaking, based on kind of primary vaccinology theory, the longer you allow between doses of vaccines, the longer you allow for the immune response from the first dose to kind of mature and become kind of fully fledged.
Yep.
And that means that your response to the second is likely to be better. And already AstraZeneca have published their data showing that the protection when you have a second dose at a shorter interval compared with what we are suggesting of 12 weeks is lower.
Yep.
So I just feel the opposite is probably true.
Okay,
But
I've got an
we'll get the data. We'll get the data.
Sorry to interrupt you there. I've got so many questions to get through. Peter
I know.
Jelf says, an intriguing question. He's having his jab later today, but he wants to know, can the AstraZeneca vaccine rollout be linked with the problem new variants from South Africa and Brazil as trials were carried out in those countries and the UK? I guess there is some concern that if lots of people have been vaccinated, it will cause this pesky virus to mutate again.
Right. So we have really low numbers of the South African variant identified in the UK so far. It's under 200. And I don't see a significant transmissibility advantage of the South African variant compared with the Kent variant, which is really now 95% of our cases. So from that perspective, I don't see it overrunning.
No,
and
what about,
therefore I just don't think that's a concern.
You did reassure us about that on Monday, but what about the fact that in Bristol and now Manchester this week, we've seen that Kent variant, the first variant in the UK, mutate into the South African variant? Could that mean that it could become the dominant one in this country?
I think the data on the Bristol variant, I see if I've got a figure I can share with you. Yeah, it's 21 genomically confirmed cases, so it's tiny. And again, it's just far too early to understand anything more about that virus, but it does contain the 484K mutation, which is the same as the South African. But whether it materially in epidemiological terms represents something different from the South African strain, where we know it's not outstripping the growth of the existing virus, then I think it's just too early to say.
Okay.
What I think it does do is it tells us that in the long run, we are going to have to vary the strains of these vaccines, and we are almost certainly going to need some form of revaccination program going forwards.
Lots of viewers aren't at all thinking about going on holiday at the moment anywhere in the world. Some of them are. It is a story today. Nicola Sadgers wants to know, will our UK holiday go ahead at the end of May? We've heard the Transport Secretary, Grant Shapps, this morning, haven't we, saying don't book holidays here or abroad right now. What's your take?
Disease levels are still very high in the UK. They are coming down, and I'm hopeful that they are going to drop further, and that it will take a bit longer, unfortunately, for that kind of big bulge in the hospital system to drop away, as it's much quicker to catch coronavirus and become very ill with it than it is to actually get better from it in hospital. So that'll take longer. We just can't say how this is going to play out yet. I want those vaccine effectiveness data in the next couple of weeks. I also want to see data on how these vaccines are reducing transmission. That's going to take a bit longer. I want to see data on how they are reducing the likelihood of being hospitalized and the likelihood of death. That's going to take a bit longer too. When we get into that kind of safer knowledge zone, then I think we can start to make more sensible guesstimates of how quickly, how safely one can ease restrictions and get back to things more normally, including, something we all want to do, which is go on holiday in the summer. Yeah. But it's like being on a hill in a car, and it's a very steep hill, and you've got your foot on the foot brake, and you're just pulling up on the handbrake handle. Now, until you really know that handbrake's biting and holding the car steady, stationary, then it would be a very foolish person that, all in one go just whip their foot off the brake pedal. You do it very gingerly and carefully and slowly, don't you? Because you want to be sure that the handbrake is holding. And the vaccines are our handbrake here. And, the foot brake is the restrictions we're under. And I don't want to take the foot off the pedal in a rash and silly way until I know that the handbrake is holding.
Let's continue with a question from Alan Dominey, who writes, I'm shielding. I received my first jab last Sunday. With the shielding date due to end on February the 21st, will I be safe to go back to work?
Right. So we'll have to wait and see when we get to the end of the shielding date what the continuing advice is. But you need 2 doses of the vaccine. That's very clear. And, we'll have to look at that advice at the time. I don't have an answer that's complete at this point. OK, Bill Lowe is looking ahead. He asks, can 2 people who've had 2 injections meet 2 people who have also had 2 doses? No. Nobody can break the rules until we're more certain about the data, more certain about how the vaccines are working, more certain about whether the vaccines are also reducing transmission. Sorry, it's just one of those situations where we have to be in this together, and the rules, as I say to every single person I vaccinate, the rules continue to apply to you until we say it is safe to do otherwise. Anthony Helen wants to know how and why are many thousands still being infected every day when we are in lockdown in England? Okay, right. The way to stop infections altogether is to see absolutely nobody. But lockdown doesn't involve that. It involves going to work for many people who cannot work from home. It involves travel to and from work for people who cannot work from home. And of course, when somebody does get COVID-19 infection, we absolutely need them to stay at home and isolate because we don't want them to spread it to other households. But inevitably, there is some transmission within households too. It is just a fact of life that the only way you can completely get down to 0 infections is to live as a hermit. And none of us can do that. And the infection rate is falling really rapidly now. It's just going to take time. Jackie Hodgson writes, please explain why we did not close our borders last year as other countries did. They seem to be living a better life with no mutant strains. Yeah, there'll come a time to look properly at the response to the pandemic overall. Closing borders now, the context is different. First of all, we have a vaccine program that is being rolled out really rapidly that I'm very sure is going to succeed, that we need to protect. And secondly, unlike a year ago, we now have mutations and variants cropping up. And again, we don't want those to threaten the vaccine program. And that's another good reason to be very cautious about travel and borders right now. A really simple question, but a really important one, I think. Thomas Blount wants to know, when I get the vaccine, could I still get COVID? If you want a one-word answer to that, the answer is yes, because no vaccine is 100% effective. No vaccine in the world that I've ever known of is 100% effective. Is the likelihood that you'll get COVID much, much lower once you've had the vaccine? Yes, very clearly so. Do I believe that the data quite soon are going to show us that even if you get it, you are much, much less likely to be hospitalized and have severe illness? Yes. Am I hopeful but need to see the data that if you get it still, having had the vaccine, you're going to be actually shedding the virus at much lower levels and therefore much less risk to others around you. I'm hopeful that we'll see that, but I need to see the data.
Okay, lots of asthma sufferers have got in touch. They want to know, like Greg, why are people with asthma not considered a priority despite NHS warnings about its likely impact? And they're talking about they're not in the top levels of the cohorts for the vaccination.
Yeah. Well, people with very severe asthma are in the top cohorts, but by and large, the signal for people with mild asthma is it's based on evidence. It's not as severe.
Talking about the vaccination programme, Marilyn Mills has written to say an issue that lots of people have been debating for some time now. Should police and supermarket workers soon be in line for the vaccine? They receive abuse and have been putting their lives at risk throughout this pandemic. Yeah,
everybody is asking similar questions, and the priority in phase 1 of the vaccination programme, as set by our independent committee, the JCVI, the priority is absolutely to target the groups who are at the highest risk of dying, and of course our health and social care workers. The second phase of the vaccine programme will begin once the first is completed, and it is a matter that ministers are considering at the moment, about what is the right approach within that other cohort. But if you're a supermarket worker and you have a high-risk condition, or you're a supermarket worker and you're over the age of 50, you're absolutely within the first wave priority cohorts 1 to 9, as identified by the JCVI.
A practical question now, again, one that lots and lots of people have been in touch to get an answer from you about. Anne-Louise Brown asking, can you still have the vaccine if you are allergic to penicillin?
The only reasons why you can't have the vaccine are if you are allergic to one of the ingredients in the vaccine, and there's no penicillin in either of the vaccines. But have a look on the MHRA website and you can see exactly what is in each of the vaccines.
OK, a clear answer to that one. On the issue of masks and mask wearing, N95s, the medical grade ones, some countries have started saying people should wear them on trains and buses. Should we be thinking about doing that now?
Well, SAGE has looked at this again, and the answer to that is that's not considered necessary. I would say that you just have to be very careful with the N95 categorisation, and the Health and Safety Executive has really been quite clear on this point, that there are many models out there that are available that claim to be KN95 and may not be N95 anyway. So you might have an entirely false reassurance if you've happened to pick one that isn't approved.
What about the so-called doing a Biden and double masking, especially if you're in a situation where you feel as if you are in a crowd of people, even during lockdown?
I've seen people doing that on the tube. I think it's a matter of personal preference. I don't have any data on that.
Jonathan Van-Tam, are you disappointed by the lack of social distancing you see out and about sometimes? We don't really seem to have really got this clear rule, I suppose, from the beginning that we should be 2 metres apart, even if we're going out for a walk with a friend or any kind of exercise.
I am sometimes disappointed, as I'm sure we all are, with what we see, but the vast majority of people do their very best to follow the rules all of the time. And, it is a year on. It's a big thing to have to keep on reminding yourself, about social distancing. It's easy to forget. And also, on top of that, human beings, we do social contact, that's what we enjoy. So it's really very, very difficult for us. That doesn't mean you shouldn't do it.
Yeah, but it's an acknowledgement that it is hard. It's hard.
I acknowledge it's difficult.
Iram Ishak has a question back to vaccines. He or she wants to know, do any of the vaccines affect fertility in women?
I've never known a vaccine that affects fertility. And I think this is just wholesale nonsense. And I'm really, disappointed and dismayed that it's such an emotive subject. And it frightens so many people, and it's completely and utterly groundless.
Okay, Linda Morris, again, another question where we've had lots of different people contacting us on the same issue. Does the immune system react differently in people with autoimmune illness if they are infected with COVID or have had the vaccine?
I don't think we have any reasons to suppose that it will react differently. Whether people will not react as well to the vaccines if their immune system is damaged in some way is a possibility, and something that work is going on to look at. And I think that just helps make the point, really. We're not safe till we're all safe with this disease. And I understand that tension. And that's why, vaccination is a brilliant thing, because for people who aren't going to be as well protected from the vaccine because their immune systems are damaged, if we bring the infection rates down in the community as a whole, then the chances of these people then coming into contact with the virus in their everyday lives is also massively reduced.
Which is why it's crucial for everyone who is offered the vaccine to try and keep that appointment and get their jab. What's your message for anyone who still isn't sure? We know we've reported, haven't we, and discussed about the fact that certain members of certain communities are still not convinced. Yeah.
So two messages there, I think. This virus just does not care what community you're from, what your ethnicity is, what your skin color is. It doesn't even notice. It's just that you're a wonderful human being with no immunity to COVID-19, and you're ripe to infect and to make ill. That's how the virus frames things. So I wouldn't frame it any differently. And in terms of should I have it, should I not? Look at the uptake that's already been published. I think Secretary of State Matt Hancock mentioned it on Monday when we were at the presser together. I think it was 93% uptake in the 80 pluses overall, even
numbers.
higher than that in the 75, 79. As you say, incredible numbers, quite unseen ever before, for example, with flu vaccines, which are another vaccination targeted at the elderly and the high risk. So, people get it.
Yeah, people certainly.
There's your answer. Yeah,
get it here, don't they? They understand the importance of it, which is fantastic.
Yeah, I think we're going to have to stop now.
Okay, can I ask you two more very, very quick questions, because I appreciate you're an extremely busy man. We do appreciate you joining us. Lots of viewers want to know a really easy question for you. How's your mum?
Oh, she's great, thank you. Yep. She's had her first dose. I don't think she's had her appointment through for the second yet, but yeah, she's fine.
And I will end on a question that lots of people have been speculating about. Will we see you on Strictly Come Dancing?
I think it would be rather like watching Jumbo on ice. But I don't want to spoil the bookmaker's book, so I'll say no more than that.
That's very much a politician's answer. Professor Jonathan Van-Tam, thank you very much for joining us today. Please do come back and join us again, because we have been inundated with questions for you. And as I said at the start of this, with lots of people wanting to thank you for your hard work and for your clarity and what people have perceived as your honesty throughout the pandemic as well. So I do appreciate you joining us today. Thank you.
Thanks very much.